urinary tract shows that picture. No fever, nothing. Sometimes you allow the immune system to take care of it. You might not treat. Even when there are laboratory features showing that this person might actually have urinary tract, you might not treat. But if you see that same picture in a pregnant woman, whether there is symptom or not, you will treat. Because of the fact that sometimes this urinary tract infection can be associated with preterm contraction, the woman start having contraction before time, you will just treat because of the inherent possible complications that might arise from not treating asymptomatic urinary tract infection in a pregnant woman. I don't even understand. But generally, the symptoms are so simple. The symptoms you will see is dependent on whether we have an ascending or a descending urinary tract infection. If you're having a descending urinary tract infection, because the thing is descending, something have already caused it. Maybe it might go elderly woman who has been sick, weak, vomiting. There are so many problems which shows that there is now infection in the blood, which is called sepsis. That sepsis will now affect the urinary tract secondarily. So in that case, there must be fever, weakness, loin pain, and all whatnot, showing that we are having pyelonephritis, which will eventually come down. So that time, you might not even have the frequent urination or pain. But the classical thing that you find in descending urinary tract infection is that there is always pain. And that pain is coming at the point of the kidney. That area where the kidney is located is where you will see the pain. Because it's a descending. So the first organ to be affected in descending urinary tract infection is what? Kidney. Because that is where the urine starts being formed from. I don't know if you understand. So in descending urinary tract infection, the first sign you see nabucadi pain at that area. Then other things can follow. But in ascending, which is the commonest one we have among women, that one is usually 90% or more than caused by self-contamination. The commonest symptom you see in that one is frequent urination, painful urination, urgency. And that person, if you start feeling like to urinate, once you have that urge to urinate, you will start feeling like if I don't urinate now, I will urinate it on myself. You just have that strong urge to urinate that if I don't urinate, in fact, when we are discussing, that person have run to the toilet. Before you finish, he has come out. And you want to ask him, why did you go to urinate? He will come out again and urinate again. So that is the commonest thing you see in ascending urinary tract infection. That's the commonest one.